So COVID-19 in Brazil, we are a bit lagging in comparison to other countries, right? The epidemic started on China, and now they are under control. It looks like they have the epidemic under control in China. Things are, after this exploded in Europe, we see very chaotic situations in Italy, Spain, and other countries in Europe and Germany. And now they're starting to control the epidemic there. And I think the third wave was here, is being here in America. We see the United States with a lot of cases. The situation is really bad in the United States. And in Brazil, I think we are a bit behind this. We started to have cases in the last couple of weeks. I'd say in the last 4 weeks. The epidemic started from people from the upper class, people that travel abroad, and probably they got contaminated in trips to Italy and countries in Europe. So this first wave of contamination in Brazil is from the people that have access to the private healthcare system, which is coping with the cases. We see lots of people dying still. We are today, I imagine, 1,300 deaths from COVID-19 in Brazil, but the disease has not yet spread to the overall population, which is our biggest fear here, because we have a divided health system in Brazil. We have the private health system that responds to 20% of the population that is able to, only 20% of the population have access to this private health system, but 80% of the population are in the public health system, which is not as equipped as the private one. So we fear the disease spreading in the lower classes, in the general population, and the public health system not being able to cope with all the cases at the same time. We don't have much data on what is happening here because we're not testing everyone. We are having trouble to find resources to test people, and the allocation of resources, public health system from the Brazilian health has been into building campaign hospitals. So we're seeing lots of campaign hospitals being built in stadiums, in conference centers. These are all initiatives from the local governments, but supported by the health ministry. And to find tests, we don't have still the ability to test everyone as we should. I've been in conversations with colleagues from the companies that are going to have this test, and they say in the next couple of 2-3 weeks, maybe we increase to 30,000 tests per day. So let's see if they can do this. So we hope to have this, because then we can select better who needs to do social isolation more intensely, I would say, with more precision, and we could test the health workers and security workers that are the most important people in this moment of pandemic. So it is quite difficult to manage these patients during COVID-19 epidemic, because some of them cannot be out of the hospital during this pandemic. We have patients that have metastatic disease, have patients that need to do adjuvant treatment, neoadjuvant treatment, that have already a disease that is already quite aggressive and quite dangerous to their health. So having a cancer is more dangerous than the chance of getting COVID-19. But if you have cancer and you get COVID-19, then things can go really bad. So what we are doing, we don't have a specific regulation for a law or factual decision, but people are talking about this in the in social media. You see medical organizations advocating to patients that really need treatment, they have to get treatment. Patients that you can delay, you delay. For instance, you have to do only controls, you're doing hormone therapy, and you need just to check if everything is fine. You do this in 2 or 3 months. If you have neoadjuvant treatment for gastric cancer, then you do the neoadjuvant treatment now. So this is an interesting approach, because you empty the hospital, so you lower the chance for the person that does not need to go there at that moment, and also for the person that needs to go there because there's less people there in the hospital. We have seen also in my specific hospital, we decreased a lot the number of people doing consultations at the hospital. We just got approved teleconsultations now in Brazil during this period. And most of my patients, I do now teleconsultations, and even those ones that are doing chemotherapy. So when they arrive at the hospital, they go straight to the chemotherapy, and if they have any problems, there is a colleague there in the shift that can look for these patients. Or if I have to do some, it has to be, I don't know, physical examination that I cannot do for in teleconsultations, I tell the colleagues there, listen, there's a patient going today at the hospital and we need to check this and that. And then you decrease the number of health professionals that get in contact with the patient. So this is protects the patient and protects the health professionals as well. So this is a couple of things that people are doing, but there's not a unified, I would say, law unified recommendation. People are doing things that make sense, and I think most of them are doing this quite in a nice way, in a correct way. I think clinical research is basically on hold now. People are not doing it. All the trials we had open, they stopped recruiting now. So I think it will be an impact for clinical research in the moment. Also, this is interesting because we have to focus our research efforts in the pandemic now, because this is the biggest threat to human population now. For sure that will have negative impact in cancer research. But I hope after this thing's finished and we can go back to with the same enthusiasm we had before. But for sure, this will impact lots of stuff in research conferences, medical education, even the things I'm reading now. I'm reading only COVID-19. I don't read any cancer research anymore. So we are, I would say, on hold. Everything is now focused on COVID-19. So this is a very complicated issue. I don't think there's a magical solution. I'm thinking myself how I will deal with my anxiety. I, in particular, have asthma, and it's kind of complicated asthma. So I'm the, I'll say, how to say it in Brazil, there's a specific name, but a risk group if I get COVID-19, maybe I go to intensive care and I can even die of this disease. So it's quite stressful for me. For patients, likewise, because they have diseases that put them on risk to have a more complicated evolution of complicated course of disease. I've been talking with lots of people recently about this. We had teleconferences with colleagues in Italy and in the most affected countries in the planet. And these guys in Italy, Spain, United States, they are all into a very stressful situation, and some of them, they got the disease already. So it depends a lot on the person, right? There are people that say they do exercises, they don't talk about this when they're out of the hospital. There's one person specifically that said that she started to bake cakes. Maybe this changed her focus out of COVID-19. Myself, what I'm doing now, I'm very active in social media. I produce a lot of material for patients, and it's been quite stressful because there's a kind of feeling that things are political right now, because it is being difficult for everyone, and social isolation is not it's not easy, right? In particular for people that need to get the money now to dinner later, right? And all the recommendations that you do looks like they are political things that you do, speaking in pro of the president or against the president, in pro of the governor, and these things start to freak me out. And then I say, man, I need to stop for a week. I don't need. I'm just communicating medical information. I'm not entering the political debate. You know? So my way of dealing with this was I gave the information, TV is giving the information. Now I have to breathe for 1 week and then I come back. So everyone has to find their own way to what makes them relieve a bit the stress from this epidemic, which is very difficult. It's very difficult. There's no magic solution. There will be ups and downs for everyone. But one thing's for sure, this thing will pass in a couple of months, I would say. So let's try to deal with this during this period. I would say uh, people have to cooperate now for cancer care. I would say colleagues have to cooperate. We as doctors, we work in hospitals, we work in clinics, we work together, right? But this togetherness is something like we just work in the same hospital and we treat patients that comes to the same institutions. After this patient come into my room, it's my own job. I'm doing this by myself. And this cannot be done anymore because I cannot go to the hospital in that moment. So I need someone to check my patients there at this moment. I have a colleague that he got COVID-19. I have four people in my team that got COVID-19. They are out of the hospital. Someone has to look for these patients of these specific doctors that are at home recovering from the disease. So we need really to cooperate as a team now. I think teams inside oncology, uh, and not only inside oncology, but inside the hospital, people have to understand that we have a particular set of patients, a particular profile of patients that need to be protected from COVID-19. So what we did there in our hospital is oncology department, people that work here, they don't go anywhere else in the hospital. They only stay in here. And if you want to enter here, we do a double check in your temperature, symptoms, and everything. Anyone, even the guys from other sectors of the hospital, or the nurses, or the doctors, people from the cleaning staff. So we have to cooperate and understand that these patients, they are different from the others. They are at higher risk, and we have to cooperate inside the hospital and between the colleagues, but really working as a team, and not only my patient, your patient, or these are patients from the institution, and we have to work like this. That's my a personal way of seeing the care that we have to deliver now. But I think this is something that is working for us in our hospital here.